And we will distribute 0.5 each side. For these injections, I usually take a 30 or 32 gauge needle. And if it's needed, I change on each side. If it's you feel it. If it's not comfortable, better to change to not make the patient suffer. So this is a ready product. So I usually ask my patient to open the eyes. You can look up a bit. I come close to the lower eyelid, to the lash, and inject small drops of our product. If you see the molar fat, you do not inject very deep, especially in the molar fat, because also the patient can have some swelling. But this product usually do not give it. You just need to analyze your patient and also ask if the patient vegetarian or not, because they can have swelling just because they do not have enough proteins in their body, do not receive them from any food. I had a patient like that had a huge swelling for a couple of days, and she knew about it, and she never eat anything, any meat, but nothing from the vegetables as well, which is very bad for skin. So I advise to eat meat. It can be 2 or 3 rows on the lower eyelid. Can be even more if you see that you have enough product. Now you can close your eyes if you want, and I go on the upper eyelid, but don't go to the moving parts, just on the top. Also, some of my patients after blepharoplasty like this treatment, but because they see lifting effect, and it helps to improve skin quality, especially around the scars, and make them less visible. And now, sorry, I will go to this temple side. She doesn't have numbing here, so just let me know how do you feel, please. Is it okay for now? Okay. Because as I said, it's not only around the eye area. It's also we go to the temple, we go to the hair growth, because we want to pay attention, like you wear in the glasses, to all this area. And think to the combination, the product can give very good lifting effect. Small drops. Do you see or not? It's good. If you have any questions, I can reply just while I'm doing this. So a bit left. Painful?
Is it approximately 5 millimeters between every injection point, or how?
Yes, kind of 5. I like to do more injections, but very small doses of the product, because I want to mainly integrate the product everywhere. It's spreading, of course, but I don't know. I'm not the fan of big papules to make the patient suffer. And after the treatment, unfortunately, our patient has now a lot of makeup. But even when I inject eye area, I apply Jalupro mask after for all the face and eye area as well. When it's not a demonstration, of course, you can wash the face of your patient and just apply mask after. Mask helps to pull the papules back into the skin, which is very good, and rehabilitation is way better and faster. So we injected 0.5 now. I will press a bit.
How deep do you go? Is it like
Intradermal,
just the normal?
yes.
And even here, is it not more superficial?
It is superficial, yes.
Yeah.
It is superficial. You don't go, it's not like a super hydro, you don't go deep. You want to influence on skin, and with all the other injections and products, HMW, Classic, Young Eye, you will inject only intradermal into the skin. And we come close. Small, small drops of papules of the product. I usually stretch the skin with the fingers. It helps me to avoid bruises in this area. It's just like a life hack, but I'm sure everyone knows this. Because if the vessel system is very active, you see it. Of course, you won't create a bruise and inject into the small vessels. Everything can happen, but we want the best for the patient. The treatment should be repeated in 2 weeks, max 3 weeks, but I prefer 2 weeks. Is it okay? After I injected around the eye, I start to inject with the temple. So everything that will left, you can spread on the temple area. And also, this is not mesotherapy, but you don't want to lose the product. With mesotherapy, we lose a lot. You can pull the product, and then when you take your finger out, you just wait a bit. So hold on in the skin, and you will leave everything in the skin, the last drop. We lose a bit, of course, but it helps. Yeah, that's it. Do you have questions? Yes, good.
About the Botox, if you want to better the area even better, like do you do the Botox first and then 2 weeks this one, or how do you?
I can inject Botox in the same session with Young Eye. First I inject Botox, then I inject Young Eye. Because you need to apply numbing cream, and I do not inject Botox with numbing, so first will be Botox, then Young Eye. But this is not a Jalupro protocol, so never mix together botulinum toxin with Young Eye, only with Classic. And if you want to inject Botox, this is just separately. First Botox, then Young Eye.